addition to COVID-19 cure, treatment, and research, we have successfully at the Korea National Institute of Health have successfully found and researched the antibody protein, which will be very crucial in developing the cure for the COVID-19. And based on the blood samples of the confirmed cases, we have been able to successfully research and find the antibody protein, which is known as the probe, and we will go into full-fledged research on the cure of the COVID-19. So far, the Korea National Institute of Health has received applications from reseachers, and we have also done research on other medical drugs which could have the possibility of being used as the cure for the COVID-19. And we will be also intensifying and facilitating more cooperative research with other institutions to speed up the process. And we will also make an animal-based model for the cure, and we will also expand this so that it could be used on humans. And we will be also mulling over the possibility of establishing a separate institution for the research for the cure against the corona outbreak. And to the public, we once again want to highlight the importance of complying with personal sanitary practices as well as keeping social distancing. And we have elaborated this numerous times, but when you talked with others, please be careful that your droplets, because droplets are the main route of infection when it comes to COVID-19. So please stand about 2 meters apart from each other. And please, when you cough, please cover your mouth with your elbows or sleeves. So keeping this coughing etiquette is very important. If you have fever or respiratory symptoms, please refrain from going outside, and also refrain from going to group gatherings in closed-door places like your appointments as well as religious gatherings. And in many institutions and corporations, we advise you to urge your employees to work from home. And if you have fever or respiratory symptoms, refrain from going to school or work, or stay at home and monitor your conditions for the next 3 to 4 days. If you have any respiratory symptoms, before you visit the medical center, please call the 1339 call center or the public health centers first, and please visit the screening center. And when you do so, you have to wear your face mask because you have respiratory symptoms, and please use your own vehicle. For those of you who have other diseases, other illnesses, in order to protect yourself when you make visits to the medical centers, we have stationed and designated public relief hospitals, which have a special designated zone for those who have other symptoms other than respiratory diseases. So please take use of that, and that's all from me. Thank you.
Meanwhile, in the U.S., Americans go untested, which guarantees the spreading of the virus. Those infected and uninsured will not be treated, but left to suffer or die. This is American genocide.
HHS has designated the coronavirus test as an essential health benefit. That means, by definition, it's covered in the private health insurance of every American, as well as covered by Medicare and Medicaid. And we're working with members of Congress, and we'll be monitoring the costs very carefully.
I'm going to read a statement from one of our quarantine nurses who works at a Northern California Kaiser facility. She chose to share her experience anonymously, but she is hoping that her story can be elevated to raise public awareness about concerns for the coronavirus response. She said, "As a nurse, I'm very concerned that not enough is being done to stop the spread of the coronavirus. I know because I am currently sick, in quarantine, after caring for a patient who tested positive. I am awaiting permission from the federal government to allow for my testing, even after my physician and county health professional ordered the test. The national CDC would not initiate the test. They said they would not test me because if I were wearing the recommended protective equipment, then I wouldn't have the coronavirus." What kind of science-based answer is that? What a ridiculous and uneducated response from the department that is in charge of the health of this country. Later, they called back, and now it's an issue with something called the identifier number. They claim they prioritize running samples by illness severity and that there are only so many to give out each day, so I have to wait in line for the results. This is not a ticket dispenser at the deli counter. It's a public health emergency. I'm a registered nurse, and I need to know if I'm positive before going back to care for patients. I'm appalled at the level of bureaucracy that's preventing nurses from getting tested. Delaying this test puts the whole community at risk. I have the backing of my union. Nurses aren't going to stand by and let this testing delay continue. We are going to stand together so we can make sure that we protect our patients by being protected ourselves.
There have also been contradictions about when and how many people can get tested. Take a look at that.
Anybody that needs a test gets a test. They're there. They have the tests, and the tests are beautiful. Anybody that needs a test gets a test.
We don't have enough tests today to meet what we anticipate will be the demand going forward.
Can anybody who needs a test get a test now?
The fact is the tests are out there. There was a misstep early on with regard to the test, namely a technical difficulty. But right now, about 1.1 million tests are out there now. There'll be an additional about 640,000 on, let's say, Monday, and then at least another 4 million, particularly now that we're engaging the private sector. Now, when you say that, they're out there. If you go to a doctor, it's up to the doctor to order the test. And if that happens, a person should have a test available. But it's no doubt, Chris, you have to be realistic. Early on, there was some missteps that delayed it.
I want to pick up on that, Doctor, and the question of testing. I want to put some numbers on the screen. As of Thursday, the CDC had tested only 1,583 people. In California, only 516 tests. Meanwhile, in South Korea, more than 66,000 people were tested within a week of the first case of community transmission, and they can now test 10,000 people a day. Why are we so far behind?
You know, I mean, it gets back to what I said in the beginning, that the CDC made a test. There was a technical glitch there. The CDC provides tests for the public health groups in the state and local. What we really need to do now, which were the numbers that I mentioned to you, is to get the private sector involved so that you could literally flood it with millions and millions of tests. That is happening now. But in fact, the American people need to realize that in the beginning there was a glitch, and we need to overcome that now.